So the question is, Mrs. A, who is 9 months pregnant, presents to the labor room with complaints of severe pain in abdomen and vaginal bleeding for 30 minutes. She is second gravida, that's producing second child, and delivered her first child 2 years back by cesarean delivery. On examination, she has scar tenderness, vaginal bleeding, and hematuria. On CTG, she has an abnormal fetal heart rate tracing. What is her likely clinical diagnosis? So, answer is scar rupture or dehiscence during the labor. So, this will be the correct answer. So, why is it a correct answer? We will look on various hints which are given in questions. So, first is that there is a previous 2 years back history of cesarean delivery. So, previous cesarean section, so previous C section, which is one of the biggest risk factor for the uterine skin scar rupture. Second is that there is a severe pain in abdomen. So severe pain in abdomen suggests that either there is impending rupture or there is actual rupture of uterus. Third hint is that there is scar tenderness. So third is scar tenderness. It is said that scar tenderness in a woman, so scar tenderness in a woman with previous LSCS during labor. So when during the time of labor, when a woman with previous LSCS comes with scar tenderness, always suspect scar dehiscence or rupture until proven otherwise. Fourth option is there is vaginal bleeding. So fourth hint is that there is vaginal bleeding, which is one of the common feature of uterine rupture. Then there is important clue of hematuria. So this is the fifth hint. It's a very important clue because when the lower uterine segment rupture, the bladder may also become involved. So bladder may also involved. And then most important is that the child has abnormal fetal heart rate. So fetus has abnormal heart rate tracing. So this is one of the earliest findings. So this is one of the earliest sign of uterine rupture. So generally the fetal will be having fetal bradycardia, or there will be late decelerations, and there can be variable deceleration. So these three findings will be found in the case of the scar rupture or dehiscence. So that's why the answer will be B, scar rupture or dehiscence during the labor. So this is our correct answer. Now going to see other options, like why other options are wrong. So UTI may cause dysuria may be there, frequency may be there, and sometimes hematuria may also be present. But certain things which are not being explained here is that it is not associated with previous LACS. Why is there scar tenderness in the UTI? Why will there be abnormal fetal heart rate in the case of UTI? Why there will be severe labor pain in case of UTI? And why will there be a vaginal bleeding when the patient is having problem in the urinary tract? So that's why A will be wrong. So A is wrong, B is correct. Now coming to C, that why is it not a labor pain? So why is it not a labor pain? So labor pain, the normal labor pain will never have scar tenderness. It will not be having hematuria, and there will not be fetal distress. So fetal distress will not be there. So these three things will not be. That's why C is wrong. Then comes the rupture of urinary bladder. So only hematuria explains it. Otherwise, why, when there is rupture of urinary bladder, why is there scar tenderness? So scar tenderness will not be present. Plus there will not be previous cesarean section. Then there will be abnormal heart rate will not be there. And then why is there vaginal bleeding when there is rupture in the urinary bladder? So this is also not explained. So that's why D will also be wrong. So the answer will be scar rupture or dehiscence during the labor. So there are also certain other symptoms that are present in the scar rupture or dehiscence which can be asked in next exams. So what are other features of scar tenderness? So first is abnormal CTG that we have seen. So there will be abnormal CTG, and which is the most consistent finding. Second, there will be suprapubic pain, and the most important thing is even this will be persisting in between contractions. So whenever there is not even uterine contractions, even then the female will be feeling the pain. Then there is shoulder tip pain, or there will be chest pain, or there will be shortness of breath. Then fourth is there will be acute onset of scar tenderness. Then abnormal vaginal bleeding or hematuria. Then there can be cessation of uterine contractions. Then mother can have maternal tachycardia. Or hypotension or shock. Plus there can be loss of station of presenting part.